Title: The Silent Dangers. Lurking behind your blood pressure pills. Got high blood pressure? Or maybe you're one of those folks who've been popping blood pressure pills for years. Do you ever feel like as long as you swallow that little pill every day, you're in the clear? Like your blood pressure is something you don't have to worry about? Do you think that if you take your medicine correctly, you can live your life however you want, eat whatever you want, drink whatever you want, and not worry about a thing? If that's you, you absolutely need to watch this, because a misunderstanding like that could render your meds almost completely useless, even put your health in harm's way, before you even realize it. Let me start with a story about my neighbor Bob. Bob's 72 and a classic case of high blood pressure. He's been on medication longer than he's been taking vitamins. Bob is a creature of habit. The doc says once a day, so he never takes it twice. Says to take it in the morning, he doesn't wait until noon. He's always saying, your blood pressure is like raising kids. You gotta keep an eye on it all the time. But even with all his discipline, something really scary happened to him a few weeks ago. He was at the grocery store crossing the street. The light had just turned green and he stepped off the curb. All of a sudden, the world started spinning. He felt like he was going to tip over. Everything went black and his legs buckled under him. Luckily, some young guy was quick on his feet and caught him, otherwise he would have hit the ground. Bob was terrified. His heart was pounding like it wanted to jump out of his chest, and he was drenched in a cold sweat. He just couldn't understand it. Why, if he was taking his medication religiously and his numbers seemed stable, would something like this happen? Was he taking the right medicine? And would staying on it keep him alive, or just cause more problems? I'm sure Bob isn't the only one with these questions. There are countless others out there taking medication for high blood pressure and believing that they can continue with their lives as before. But they don't take notice of the warnings their bodies give them, or realize that certain foods in our daily diets might quietly be canceling out the effects of their medicine. Today, we're going to get to the bottom of this once and for all. If you, or someone you love, is taking blood pressure medication, watch this video all the way to the end. We'll tell you about 3 potentially deadly warning signs that mean you need to stop taking your medication and seek immediate medical attention. Plus, we'll go over 4 types of food that you should probably avoid because they could actually raise your blood pressure. Before we dive in, if you genuinely care about your health and your family's health, click the subscribe button below and turn on notifications so you don't miss any of our practical health tips in the future. Here, we only reveal the health truths that the mainstream media rarely tells you honestly. If you like the content we share, type 1 in the comments section. This is the warmest support for our continued creation. If you or your family are also suffering from related problems, you are also welcome to leave a message in the comment area below, and I will try my best to answer you. Okay, let's get to the topic of today. First, we need to be realistic. High blood pressure is a chronic condition. There's no magic bullet to cure it. So managing symptoms with medication is the best way to prevent heart attacks, strokes, and other serious problems. So in that respect, blood pressure pills are our friends. But as the saying goes, every medicine has its side effects. We shouldn't reject medicine just because it has side effects. We need to understand it and learn how to live with it peacefully. The common types of blood pressure meds have their own unique side effects. First, calcium channel blockers. Common names include amlodipine and nifedipine. These work kind of like road construction crews, widening the arteries that have constricted because of tension and allowing blood to flow more smoothly. The side effects include head pain and a red face, like you just drank a beer. Studies show that 20–30% of people taking these drugs experience these symptoms. Sometimes it also loosens up the artery walls and body fluid leaks into the tissues, causing swelling in the ankles or lower legs. A few people also get gum swelling. And because the body has to work hard to fight the widening of the arteries, your heart will beat faster. Second, ACE inhibitors. Many have names like lisinopril or enalapril. These are like interceptors blocking a chemical messenger that causes blood vessels to constrict, keeping them relaxed. The side effect is a stubborn, irritating, dry cough. It can feel like feathers tickling your throat, but you can't get anything up. It's especially bad at night when you lie down and you can't sleep and your family gets worried about you. About 10% to 30% of people get this. They also have a potential risk of causing hyperkalemia because they reduce the excretion of potassium. If the patient has poor kidney function itself or is also taking potassium supplements, it is easy to cause blood potassium to exceed the standard, which is very dangerous. Third, diuretics. Common names are hydrochlorothiazide and furosemide. They are like water pumps that help the kidneys flush out excess sodium and water-reducing blood volume. This is good for people with salt sensitivity or the elderly. The side effect is that sometimes it will overuse and excrete the body's necessary electrolytes. The most common is to cause hypokalemia, where people feel weak muscles, are sore, and mentally depressed. The proportion of long-term users with hypokalemia can reach 10% to 20%. For the heart, lack of potassium is a big problem. At the same time, it may secretly increase our blood sugar and uric acid levels, which is undoubtedly worse for patients with diabetes or gout. Fourth, beta blockers. Common names include metoprolol and atenolol. These act like a heart pacemaker, slowing down an excited, fast-beating heart to reduce oxygen consumption and lower blood pressure. The side effect is a slow heart rate and fatigue. You will feel tired all day and can't get motivated to do anything. Because it slows down blood circulation, some people will feel cold at the ends of their limbs. He may also affect sugar and lipid metabolism. The most important thing is that it has a terrible rebound effect when the drug is stopped, and you must not suddenly stop the drug on your own. Once suddenly stopped, the suppressed heart function will rebound retaliatorily, leading to soaring blood pressure, aggravating angina pectoris, and even inducing acute myocardial infarction. The consequences are unimaginable. Knowing these side effects isn't about being scared of medication. It's about being informed and able to work with your doctor to find the right solution. If you have a problem, you can spot it quickly. You need to talk to your doctor about your overall health, so be sure to tell your doctor what's going on, and don't suffer in silence. Side effects are one thing, but the next 3 situations are critical warning signs that you need to take seriously. If you experience any of these, stop taking your medication immediately and seek medical help. First warning: serious chest tightness, heart palpitations, and fatigue. This could be the equivalent of a power outage for your heart. You might feel that your heart is beating irregularly or racing. Your chest feels heavy and you struggle to breathe. Your limbs feel like wet noodles and you can't even lift a fork. The culprit is likely severe hypokalemia. As the diuretics lower potassium levels, the heart muscle cells can't contract and expand properly, causing arrhythmia or cardiac arrest. Immediately, stop taking all blood pressure medication. Have a family member take you to the nearest hospital if you are feeling faint. You will need to have your blood potassium and electrocardiogram checked immediately and receive professional intravenous potassium supplementation. Second warning: unbearable persistent dry cough. This is more than an inconvenience. It's torture. You might be coughing during an important meeting, waking up in the middle of the night, and people will think you have a serious lung disease. This is likely an ACE inhibitor causing a cough. If the cough is seriously affecting your sleep work and social life, this is no longer a side effect that can be tolerated, but a medical problem that must be dealt with. Go to the hospital immediately for a follow-up visit and describe the frequency, degree, and impact on your life in detail to the doctor. The doctor will replace you with a sartan drug with a similar mechanism of action, but rarely causes coughs. This problem can usually be significantly relieved within 1 to 2 weeks after changing the medicine. Third warning: repeated dizziness, lightheadedness, and fainting. Like Bob, you might experience dizziness when you sit up in bed, stand from the sofa, or even turn your head. Everything starts spinning, you see black, and you need to grab something to stay upright. This is a sign of low blood pressure, and it might be that the dose is too high or the medication is too strong. It can also be caused by dehydration. As blood pressure drops, the blood going to the brain is reduced, and you may lose consciousness. This can be dangerous for seniors due to falling and bone fractures. Take a low position, immediately lying flat, with your legs raised to increase blood supply to the brain as quickly as possible. Temporarily stop taking blood pressure medication and go to the hospital as soon as possible to adjust the treatment plan. Doctors need to reassess your blood pressure levels and find a safe dose that will effectively lower your blood pressure without causing hypotension. Now that we've talked about medicine, let's talk about food. Sometimes the medication isn't working because the food is fighting back. Here are 4 foods that people taking blood pressure medicine need to be aware of. They're roadblocks on the road to healthy blood pressure. First, food: milk and dairy products. The common misconception is that milk is good for you, so people drink it every day. The truth is that it might make the medicine less effective. The proteins and calcium in milk can create a coating around the medication, blocking it from dissolving. Plus, dairy products contain tyramine, which can cause blood vessels to constrict, raising blood pressure. Be sure to take your medication an hour or 2 before you have milk. Second, food: alcohol. It is a widely spread and harmful rumor that drinking a little alcohol can dilate blood vessels and is good for cardiovascular health. Alcohol does nothing for patients with high blood pressure. It can lead to dramatic fluctuations in blood pressure. Alcohol can briefly dilate peripheral blood vessels and create a false appearance of a decrease in blood pressure when it is first consumed, making you think it is very comfortable. But a few hours later, as the alcohol is metabolized, the blood vessels will contract retaliatorily, and at the same time the heart rate will increase, and the blood pressure will rebound sharply to a higher level than before drinking. Such roller coaster-like blood pressure fluctuations are fatal to fragile blood vessels. What's more, alcohol will seriously aggravate the side effects of drugs such as dizziness and drowsiness, which are prone to accidents. The only authorized strategy is to abstain from alcohol. For your safety, please say goodbye to alcohol completely. Third, food: caffeine. Some people think that having a cup of coffee when you feel tired is no big deal. The truth is that caffeine causes your heart to beat faster and blood vessels to constrict, which raises blood pressure. It will completely offset the effects of the antihypertensive drugs and cause ineffective fluctuations in blood pressure. If you really want a cup, drink it in the morning when your blood pressure is at the level, and not within a few hours of the medication. Fourth, food: high sodium foods. Some people think they have low sodium diets. Sodium is hidden in a lot of processed foods, like pickles, sausages, processed meats, chips, condiments, ketchup, salad dressings, soy sauce, etc. Sodium locks water into your blood, which increases blood volume and puts pressure on the artery walls. A high sodium diet can fight the effects of the medication. All right, friends, we've talked about blood pressure meds in depth today. At the end of the video, let's quickly review it and make a clear and memorable summary. I hope these key knowledge points can serve as a reassurance to you, allowing you to walk more steadily and comfortably on the road to air pressure in the future. First of all, we must keep in mind the 3 red alerts issued by the body, which are life-threatening signals for help. Alert: 1. Heart power outage, that is severe chest tightness, shortness of breath, panic, palpitations, and limb weakness. This is often a manifestation of severe hypokalemia and must be stopped immediately. Seek medical attention immediately. Alert 2. Breathing shouts, referring to the kind of unbearable, non-stop, continuous dry cough. This is mostly a strong reaction to prill drugs and requires a doctor to change the drug as soon as possible. Alert 3. Brain ischemia, manifested as repeated dizziness and glare, especially obvious when changing positions, black eyes, and even fainting. This is a dangerous sign of low blood pressure and requires immediate discontinuation of the drug and adjustment of the treatment plan. Secondly, we must always be wary of 4 kinds of food. They are the culprits that steal your drug effect. Food. 1. Milk and dairy products. Please remember that it is not that you cannot eat them, but that you must stagger the medication time by at least 1 hour. Food. 2. All alcoholic beverages. For patients with high blood pressure, it does no good and has no harm. The best choice is to abstain from alcohol completely. Food. Shan, strong tea and coffee. They are nerve stimulants that will interfere with blood pressure and must be separated from the drug by more than 2 hours, and it is not advisable to be strong. Food. 4. High salt foods. This includes not only salt, but also all enteritis majors, such as pickles, preserved meat sauces, and instant noodles. They are the biggest enemy of antihypertensive drugs. High blood pressure is not a cold or fever that can be cured by taking medicine for a few days. It is more like a partner that we need to coexist and live with peacefully for life. Antihypertensive drugs are the most important tool for us to maintain this peaceful relationship. Please do not treat it as a one-size-fits-all insurance. Once swallowed, everything will be fine. It requires our careful care and smart cooperation. Please be sure to treat yourself as the commander-in-chief of your health. Your daily life is a battle for health. Doctors are your senior staff providing you with the most professional strategic advice. Drugs are your core weapons, providing you with the most critical fire resources. But in the end, how to deploy troops, how to allocate resources, and how to avoid traps all require you to make decisions yourself. So, I sincerely ask you, first, please become a learning patient. Take the initiative to understand your body, understand the drugs you are taking, and understand all the precautions we talked about today. Knowledge is the foundation for you to overcome fear and calmly deal with everything. Second, please become a communicative patient. Treat your doctor as the most trustworthy comrade in arms. Do not be afraid to ask questions, and do not hide any discomfort or doubts. The clearer you describe, the more accurate the combat plan the doctor gives. Third, please become a self-disciplined patient. The road to managing blood pressure is destined to be a game with one's own habits. Every time you say no to the temptation of food, every time you insist on going out for a walk when you are lazy, and every time you resolve anger with a peaceful attitude, you are accumulating the most valuable wealth for your future health and longevity. This road may be long, but you are never alone. Every effort you make is not only a true to your own life, but also a warm and profound commitment to every family member who loves you behind you. I hope you can hold scientific weapons in your hands and have a peaceful courage in your heart to fight a beautiful victory in this battle of life. Enjoy health and enjoy life. We will see you in the next video.